The following segment is sponsored by Optum Utah. September is National Recovery Month, and Karina Fasig is here from Optum Utah to tell us how we can increase our understanding of mental health and where you can turn for help. Thank you so much for being here, Karina.
Thank you. Happy to be back.
Mental health is such an important topic for me and for so many people out there, and there are some actually alarming data and troubling trends taking place right now in the country as it stands. Talk to us about that.
Yeah, so the data shows that in 2023, suicide took the lives of over 49,000 individuals. Jeez. So that's equivalent to, one death every 11 minutes to suicide. Okay. It was actually the second leading cause of death in individuals ages ranged 10 to 34 in our nation. And unfortunately, Utah is actually ranked one of the worst in the nation when it comes to suicide rates. So we're actually ranked number 5 in the nation when it comes to an age-adjusted death rate of about 21 Utahns for every 100,000 Utahns due to suicide. So very alarming.
That's, really hard to hear, but we need to know that. So how do we recognize common mental health factors and warning signs, either in ourselves or a loved one?
Yeah, so there's so many vague generalized warning signs that and signs and symptoms that overlap between mental health disorders. Obviously, as a primary care provider, we have the DSM-5 criteria and several screenings that diagnose particular mental health disorders, but in general, signs and symptoms that you should look out for: excessive worrying, feeling down, depressed, or hopeless, difficulty with concentration, changes in sleep behaviors, changes in eating habits, and then unfortunately, some of these early signs and symptoms can even be substance use disorders when it comes to drugs and alcohol.
All right, so September is actually National Recovery Month, and this is aiming to increase awareness and understanding of mental health and of substance use disorders. How common are substance use disorders?
Unfortunately, very common. So according to the CDC, 1 in 6 Americans reported experiencing a substance use disorder sometime in their lifetime. Okay. And that can be, any substance, drugs, alcohol. And even more alarming, so this is always a good reminder as a primary care provider of why it's so important to have such open dialogue with your patients, is that substance use disorder often leads to opioid use disorder, which where it starts is being prescribed opioids by your primary care provider or a healthcare professional.
Okay, so why is it so important for parents to have conversations with their kids about a mental and emotional health?
So important because when it comes to suicidal ideations and suicide attempts, it's usually in young adolescents or young patients who are experiencing a severe mental health disorder, usually depression, but it can be a wide variety of mental health disorders, and so it's always so important to ask the correct questions and be aware of the warning signs to look out for.
Yeah, and we've talked about the facts and the stats, which is hard to hear, but you have to know that so you can be aware. Where can we go for more information and to get help?
Yes, so Optum has actually implemented a new behavioral health program, specifically at our Optum Primary Care Wasatch Peak location here in Layton, Utah. It's amazing. So we have a team of behavioral health professionals, social workers, therapists, all working collaboratively with us, the primary care provider, which at our Layton location we have 6 of us family medicine providers. It's really great because the primary care provider can still be involved and collaborate with the care. And we help a variety of patients all the way from pediatrics to geriatrics, all the way from active military and veterans. And so come see us at Layton Optum Wasatch Peak.
There you go. There is hope and there is help. For more information, there's a website at the bottom of the screen. Karina, thank you for everything you're doing.
Yes, thank you.